Okay, I'm going to show you some of the advanced capabilities of the CS Model Plus software. This is what it looks like when you launch the software. This is an actual patient that I am treating with aligners, and I planned it within this software. I launched it from our OrthoTrack practice management software into CS Model Plus, and what you get here is it takes the STL file and makes a nice ortho printed or an ortho trim model, flat bases and occlusion. And just as an aside, this is useful in the couple times that I've had to print out, 3D print a ortho trim model for either to show a referring dentist, or a couple times insurance companies have asked for flat-based ortho trim models to, I guess, check the occlusion. And this is by far the easiest way that I've found to do this, to make a 3D printed model. You just go right from this screen, hit the export button, and it'll generate an STL file that you can print on your printer. So that's not what we're talking about today, though. We're going to talk about in-house aligners and using the CS Model Plus software to generate the models for those aligners. So the first thing that you'll want to do is run the segmentation wizard, which will segment the teeth, separate the teeth out individually. This is pretty much automatic. It's very accurate. I'll show you how you can make some small manual changes if you need to, but most times it's very, very accurate. So just take a few more seconds to get that segmentation complete. Alrighty, so this is what you get. The gingiva is pink and the teeth are white. I usually like to just, if I need to, play with these arrows, which just show the rotations of the teeth. They're usually pretty accurate, but I'll just take a few seconds to adjust a few of them, because when it comes time to do your automatic setup through the software, this will help that process make that more accurate. So as you can see, the segmentation looks really good. I don't see a lot missing, but I'll just show you how you can manually edit the borders of the teeth. So just hit this edit button, pick your tooth, and let's do tooth number 9. Maybe just get a little bit more of this. Probably not super necessary, but once you get to the end, you just double click and it'll pick it up. So let's do the same thing on tooth number 10 here. And double click at the end, and we are good to go. I think everything else looks pretty good. On the lower arch, that segmentation looks excellent. So you hit validate, and it'll take you to your next screen. So now it's time to do your setup. You hit the setup tab, and there are 4 choices here. Manual is if you just want to move the teeth all yourself without any help from the software. Aligner is what I usually use. This will mainly move just the front teeth, not moving the posterior teeth that much, and just basically aligning it. You can do both arches or one arch or the other. This optimal is basically when you set your preferences to what kind of inclusion you like. It will move everything in as well as it can into that occlusion. But I almost always use this aligner setting. This relapse setting is kind of a neat feature. If you've got patients that have been in treatment and they were perfect at the end, but they've had a little bit of relapse, if you have the scan from their final, their treatment final, then you can actually overlay a new scan on top of that, and the software will compute what needs to happen to get you back to the results of that old scan. So let's use the aligner setup, the automatic setup. Hit create, and in just a little bit it'll show you the before and then after the setup. So yeah, this is the before. You can see, she's class 1-ish, maybe a little bit class 2 on both sides, some overjet, and some pretty severely rotated and malposed incisors on the upper and the lower. It's a intermediate to fairly difficult case, and this is what the software generated, and you know, that's pretty reasonable starting point. I think this is very, very useful, not only in saving your time, but this is something that you can delegate to one of your assistants or lab people to do all these steps that I just did up to this point, and basically get you to this ClinCheck part, where you can just finalize the moves and add the attachments and things like that, and basically plan the rest of the case. But this is, you know, a good deal of the work is being done by the software. So it's not perfect. So to make some manual changes, what you'll do is just go to this is simulation number 0. You'll hit this edit button, and here is the simulation, and you can view it, you know, both jaws, uh, just individual upper and lower, or mainly I do most of the work in what they call the split jaw. So pretty good, like I said, but you know, not perfect. So what I'm going to do is just move a few of the teeth to better positions and get the setup ready for printing. So down here on the bottom, when you want to start editing, what you'll do is hit that edit and you right click on a tooth. You can also select several teeth by hitting the control button and right clicking, but I'm just going to do one tooth at a time because there's not that much to move. Down here also, this is a button that if there are spaces left between the teeth, rather than just trying to move them individually, you can hit that button and it'll close all the spaces together. This is one that I use a lot of times when I'm moving the teeth. This is the collisions, and this will tell me where I might need to do IPR, or where I might need to move the teeth a little bit more to avoid the collisions. Also, you can check out the occlusion all the way through the treatment planning. That's very useful. This is an overlay of the before and after, so you can see just how far the teeth have moved. And this button just kind of tells you the degree of difficulty of these tooth movements. Red obviously is the more difficult, yellow is medium difficulty, and white is those teeth aren't moving. And if it showed green, those are fairly easy movements. This also helps when it comes time to design your attachments, because obviously you're going to want attachments on these teeth that are red, and you may or may not want attachments on the teeth that are yellow, and probably don't need them on the teeth that are green. So let's just move a few teeth here. I'm going to go back to the collisions, and I'd like to derotate that tooth a little more, and of course you see we create a little bit of a collision. Maybe get a little distal crown tip on this central incisor. So this is the easiest way to move things. You can also go to a tooth movements table and manually move them, but I find that to be pretty cumbersome. This is good to review all the movements that you've had, but I usually like to use these wheels to move the teeth. Okay, so red means definite IPR. Yellow means less than 0.1 millimeters per side. May or may not be need a little bit of IPR. I usually will do IPR along the way. At every visit, when I give them their new aligners, I'll check the contacts with floss, and if they're super tight, I like to just take a diamond coated strip in there and do just a little bit of IPR just to kind of grease the wheels and give the teeth a little elbow room to move. Okay, so let's try to resolve some of that. Could do IPR there, but I'm going to try to avoid that as much as I can in this case. So I'm just going to move these incisors just a little buckle to minimize that. Let's see, maybe move this one a little distal, and this one a little distal. Okay, so yeah, may have to do a little IPR there. Let me just extrude this one just a hair. Okay, extrude this one just a hair too. And let's move it a little distal so we don't have a collision there. Okay. So pretty good there. Let's look at the lower. Some rotations, minor rotations to correct. Not a lot of correction to do down here. Maybe add a little lingual crown torque, buckle root torque on these canines. Correct a little bit of rotation there. Move that a little buckle. Okay, some rotation on that one. Some rotation on that one. A little torque on this one. I'll move that one a little buckle as well. Derotate a little bit. Okay, and then just a little buckle movement on and derotation here. A little bit here. Try to minimize these collisions. Okay. And then maybe do a little enameloplasty on this one. A little distal crown tip. And then extrude it just a little bit for some enameloplasty on that pointy tip. Alright, so just kind of quick and dirty. But I think this is pretty good. Good. Okay, so I usually take just another final look at both arches together. Make sure I'm happy with that. Yep, pretty reasonable. Okay, so let me check the occlusion one more time, just to make sure I didn't create any anterior interferences or anything. Looks pretty good. Yeah, this patient has a little overjet and a little bit class 2. I'll probably have her wear some elastics, do some buttons or cutouts on the aligners. But I may have to alter these thick marginal ridges a little bit to really idealize that. Anyway, hit save. And now it's time to plan the steps for the aligners. All right, again, there's the before and after. So we will go to the aligner step here. It's going to calculate the steps needed for each arch. So we got 13 steps in the upper, 12 in the lower. That's about what I would have predicted, how many steps I need. You can change your preferences. I'll show you how to do that in just a second for how many degrees per step of rotation, tip, things like that. And how much translation or linear movement per step. You can actually have several different settings. If you want to go slow at one point during the treatment and faster at another point, you can actually assign that at different steps during the treatment. So again, this is showing the difficulty of the movement. Obviously, that central incisor is moving a lot of rotation, some extrusion, and this lower incisor is also moving quite a bit too because it was fairly rotated. This is good for deciding, which teeth may or may not need attachments. I'm pretty attachment happy, so normally I'd probably put attachments canine to canine on the upper, probably on that incisor, maybe the lower canines. If I was going to level the curve of speed and open up the bite some more, I would put attachments on the premolars. But so let's go ahead and have it generate the steps. And what it'll do is, based on your preferences, it'll generate the individual tooth movements there. And you can see as teeth are moving, the movements are getting easier and easier and easier, as you would expect. And so it gave you 13 steps. If there's not the same amount of steps per arch, what it'll do is it'll generate models that are passive in the arch that doesn't have as many steps, and you can either print those out and have the patient just continue with those to be consistent with wearing in both arches until the end of the arch that has the most steps. It'll also generate these usually 3 what they call hypercorrection or overcorrection steps, especially those difficult movements. Of course, sometimes don't always turn out the exact way we want it. So these will kind of overcorrect automatically without you having to build that in. So these are our steps, and the next thing that I'll do is I'll just show you how to do attachments. This is a pretty limited attachment library now, but I know that's going to expand with some further updates. But I'll just quickly show you how to put attachments on a couple teeth. So, like for instance, this we know this incisor will probably need an attachment. So I'll use this torque attachment kind of as a beveled attachment to get that rotation done. So you can rotate it, you can move it all over the tooth, you can make it bigger, smaller, you can bevel it more, which I'll typically do. You can move it, you can make it thicker, and it'll move it away from the tooth, but when the software generates the attachments on the different steps, it's going to fill that space in. You won't have a void or an attachment floating out in space. But let's just put a little beveled attachment there to help with that rotation. And then, of course, this canine is going to move quite a bit too. So let's, for fun, put this comma attachment on there. And again, you can resize it, move it wherever you want, all kinds of things. This is like a multi-planar attachment that can help with retention or tooth movement as a surface to push against. And when you're happy with your attachments, like I said, I would put attachments on more teeth, but for time purposes, I just wanted to show you that. So hit save, and it will put the attachments all through the treatment. Or wherever you want them. I always put them on at step 0. So when you're happy with everything, you'll go to export. And like I said, by default you'll get the ortho trim model, but nobody's going to print those out for aligners. That's going to take a ton of resin and be almost impossible to thermoform. So what I'll typically do, you can print out certain steps, you can print out all the steps, or you can export all the steps. That's typically what I'll do. I'll just put them in a folder on my server and then print them out as needed. You can print out just the upper arch, just the lower arch. Okay, we're back. You can print just the upper arch, just the lower arch. You can do like a modified ortho trimmed model with less resin, but I just do horseshoe models that essentially look like this. You can add a label with the patient's name, and it'll add the step number if you decide. What I'll usually do is for HIPAA purposes, and so that I can dispose of these when the time comes. I'll usually just use the patient initials, so then I don't have to spend a lot of time obliterating their name to protect their privacy. So you can print these models hollow, or you can print them fully solid. I very rarely will do the hollow models. The pressure you generate from thermoforming, I think risks the aligners not fitting, getting some distortion, and I find that I don't save that much resin when I'm hollow, so I'll usually do a solid model. So this is the final model. It'll print out for your attachment template. It'll print out a step 0 that you can use for that, and then all the subsequent steps that you can use to thermoform your aligners to. When you're ready to go, everything looks good, you just hit export and you're good to go. I rarely have to do this edit line cutout, but you can, if you want even thinner models, you can move these lines to print less if you feel like it, but I rarely have to do that. But that is an option. And that's pretty much it for in-house aligners and CS Model Plus software. Thank you.